Good evening, everyone. I'm Ashwini. I take great pleasure in welcoming you all to this webinar by Vaya Vikas. Today, we present an important and insightful webinar on diabetes and kidney health, protecting vital organs brought to us by NU Hospital. Diabetes is a widespread condition that can significantly impact the health of vital organs, particularly the kidneys. In this session, we will explore how diabetes affects kidney function and discuss practical steps you can take to protect your kidneys and maintain overall health. Our expert will cover essential topics including prevention, how you can reduce the risk of kidney damage, early detection, identifying the signs of kidney issues before they become severe, management strategies, effective ways to manage both diabetes and kidney health together. We invite you to engage with our speaker and gain valuable knowledge to help safeguard your health. Let's dive in and learn how to protect these vital organs. Before I start, I would like to introduce today's specialist, Dr. Ramprasad Ramalingam, MD, DNB Nephrology. Dr. Ramprasad Ramalingam is a highly qualified and experienced nephrologist with a distinguished medical career spanning over 2 decades. He holds an MD in general medicine and a DNB in nephrology. Currently, he serves as a consultant nephrologist at NU Hospitals, Bengaluru, where he has been providing expert care since 2017. Dr. Ramalingam specializes in clinical nephrology and renal transplantation with advanced interventional skills including central vein catheter insertion, renal biopsy, and peritoneal dialysis catheter placement. He is an active member of esteemed professional bodies like the Indian Society of Nephrology and the Indian Society of Peritoneal Dialysis. With a strong focus on patient care and education, Dr. Ramalingam is committed to improving kidney health and advancing nephrology practices in India. Thank you, Dr. Ramprasad, and over to you.
Good evening, everyone. I start with thanks, and it's my honor and privilege to be to share my knowledge with Vaya Vikas, especially senior citizens who are serving the society. Let's see about diabetes and kidney. We all know diabetes has two components. One is type 1 and another is type 2. In type 1 diabetes, there won't be insulin secreting cells. Insulin is secreted by beta cells, pancreatic cells, and when it is these cells get distracted due to autoimmune processes, these patients will not be having insulin in their blood. So this usually happens in the younger age group. The other one is type 2 diabetes, where actually there could be an increased insulin, but the insulin resistance will develop. The cells will not respond to insulin. So they require medication other than insulin, initial stages, which can increase the sensitivity of the insulin. In later stages, they also will require insulin. The latest study shows there are 80 crores people are affected by diabetes worldwide, both type 1, type 2 put together, 800 million. So India is offering 20 crores among them. Roughly 1/3 of patients can develop kidney disease. So prevention is very, very important among diabetes patients by early detection of diabetes and controlling the diabetes so that we can prevent kidney disease from developing in later stage. Diabetes can affect kidney in many ways. First of all, diabetes patients are having less immunity and they are prone for infection, especially urinary tract infections, and also other infections like respiratory infections can lead to sepsis. We call sepsis when the infection affects multi-organs, when there is a low blood pressure and it is life-threatening. So such patients will develop kidney disease. And also diabetes patients will have body pain and osteoarthritis, all kind of issues which results in myalgia, body pain. They may have the habit of taking painkillers like NSAIDs, like Brufen, ibuprofen, nimesulide, kind of drugs, aceclofenac, diclofenac. These drugs are injurious to kidney. So better not to take the drugs, especially without doctor's advice. When it is required, very necessary, very much necessary, that time that should be taken under supervision with limited dose schedule. The other ways diabetes can affect kidney is obstruction, that is papillary necrosis, which happens in the infection of kidney in diabetes patients. There is a structure called papilla which get necrosed and fall, and this can obstruct the urinary flow. And also stones also obstruct the urinary flow. Diabetes patients are in increased risk of developing stones, especially uric acid stones. And another way diabetes affects kidney is contrast use. Contrast use in diabetes patients increase the risk of kidney injury by exposure to this contrast material while coronary artery angiogram or while the patient undergoes some imagings to identify certain diseases, include where contrast is required, especially in CT imaging. Another cause is vascular cause, like renal vessels. Renal vessels means kidney blood vessels. These vessels in diabetic patients will get atherosclerotic clots and they will become obstructed and the flow will not be smooth, and over the period they will develop stenosis that can lead to renovascular disease that can also affect the kidney. Glomerulonephritis is also one of the more prevalent kidney disease happening in diabetes patients, especially when they develop food ulcers and that get infected. These can cause allergic reactions that will indirectly affect the kidney. And diabetic ketosis, hyperosmolar state, where the patient will have high blood sugar levels, will cause dehydration as well as infection, and sometimes infarction can related to they will develop kidney disease. And last but not the least, which is more important, is diabetic nephropathy. Diabetic nephropathy happens directly directly kidney is affected by the diabetes. It depends on the duration of diabetes. Longer the duration of diabetes, the patient will develop, and especially it is uncontrolled, patient are prone to get diabetic nephropathy. That we'll see in detail later. So kidney injury means there is a temporary kidney problem that may turn into chronic kidney problem if you are not treating on right time. So that is called as acute kidney injury. When it comes to the permanent problem, then we call it as a chronic kidney disease. So diabetic nephropathy is one of the chronic kidney disease. But other problems happening in diabetes which are reversible, we should look into. Our data says 45% of patients with AKI are having diabetes. So almost 50% of the people. So most of them are sepsis and obstruction, stone disease related, and sepsis due to urinary tract infection. We, being a subspecialty hospital for kidney diseases, we used to receive a lot of urinary tract infection, pyelonephritis, emphysema pyelonephritis, pyonephrosis, such way. And drugs related kidney disease also we are commonly seeing, especially as I told you earlier, this NSAIDs. Acute kidney injury, by prompt treatment, we are having success for complete recovery for 64%. Remaining patients will have partial recovery. Some people may land up in dialysis, permanent dialysis also. 6 out of 9 patients who recovered required steroid therapy, especially when they are affected by drugs. The urinary tract infection is one of the reversible cause of kidney damage. It should be identified and it should be treated with culture-specific antibiotic for appropriate duration. That is very, very important. And avoid NSAIDs painkillers in these patients and give appropriate hydration and strict glycemic control. That is blood sugar control. That is very, very important. Contrast use should be limited. And if at all it has to be used, it should be given with a good hydration, and other nephrotropic drugs should be removed from the prescription when you are using the contrast. For example, even metformin will predispose to contrast-induced nephropathy. And obstruction causes should be identified and treated at the earliest. So longer the duration of obstruction, the recovery of the kidney function will be less. Even they say 72 hours of obstruction can cause results in some irreversible damage to the kidney. Peripheral pulses to be checked because peripheral vascular disease, as I mentioned earlier, atherosclerotic clots and blood vessel damage can happen, lead to peripheral vascular disease that can lead to peripheral organs like limb, toes getting ulcers and gangrene that can result in infection that again leads to kidney damage. Smoking is independent risk factor for kidney disease. It should be stopped. In India, diabetic nephropathy is a leading cause of kidney disease, as in other countries also, where diabetes is a predominant condition. India is a capital of diabetes. The next follows China. Earlier, China was the leading one. Now, India is the leading population, having the leading population of diabetes patients. Commonest cause of CKD. If you go to dialysis center, any dialysis center, 50% of the patient would be on dialysis because of the diabetic nephropathy. And the age group usually falls between 45 to 65 years. And strong family clustering of chronic kidney disease is seen. Whenever one of the family member is affected by diabetic kidney disease, there is a chance other also can get affected by the diabetic kidney disease. So it's very important identifying the diabetes early stage and treating it appropriately. This diabetic nephropathy is a slow disease. It slowly, if you identify it earlier, we can control the progression. We can further slow down. Usually the creatinine is a measure of kidney disease, which is usually it is less than 1. When kidney disease start progressing, it increases from 1 to 2, 3, 4, 5, like that it will keep going up. And it reaches the stage 5 kidney disease. So if this happens, compared with other diseases, diabetic nephropathy has slow progression. But if uncontrolled sugar, it can lead to faster progression. The stages can be classified as hyperfiltration stage. Actually, in this stage, there could be a possibility creatinine may be lower. That is because of the kidney initially tries to compensate the loss and it will overproduce. And then so the functions start declining. And the earliest identified marker is microalbuminuria. I will describe it later on the subsequently. And then the proteinuria, overt proteinuria occurs. Then the renal dysfunction occurs. Most of the patients with diabetic nephropathy will be asymptomatic. So this insists the importance of early screening of this diabetic population for kidney disease with doing blood test and urine test. And swelling of feet can happen once the patient have the disease progression. And new onset of hypertension. Whenever diabetic patients having hypertension earlier to diabetes is different. Those who are identified as diabetes and later on they get hypertension, this hypertension may be part of because of they have developed kidney disease newly. So it is an indirect indicator. So we have to check them for kidney disease. And also those who are having good glycemic control with medication, suddenly will start having low sugars with the same medication which were they using earlier on the same type of diet, their sugars will start falling. This also is an indirect indicator that kidney function was getting worse. So what happens? The insulin will get less metabolized by the kidney, dysfunctional kidney. So that insulin action will be prolonged. So the patient will start having low sugars. So this is also an indicator. Then worsening of swelling, breathlessness, tiredness, itching, and generalized weakness. These are all non-specific symptoms, but it can be a manifestation of kidney disease. That is why we insist on doing urine analysis. Whenever you are going to your diabetologist, getting sugars checked and keeping it controlled is not enough. So always when you do fasting blood sugar, postprandial blood sugar, please check your urine analysis also, so that we can identify the protein leak, which is the earliest manifestation of diabetic kidney disease. So what is microalbuminuria? It is the minimal. That is the amount where our body will secrete little amount of urine, protein in urine, where there is a limited amount. When it crosses that, for example, 30 milligram, it crosses 30 milligram per day albumin excretion, we call it as microalbuminuria. When it crosses above 300 milligram, it comes to say proteinuria. That is picked with the urine analysis. So whenever urine analysis we are doing, when the protein comes nil, it is good. But still you have to check microalbuminuria to detect minimal level of proteinuria. If urine analysis shows proteinuria already, no need to do microalbuminuria. With that itself, we are come to know there is a protein leak. So this is the patient we have to focus, and we have to start treating for them for kidney disease, so that the further progression will be prevented. Then next comes serum creatinine. Serum creatinine is a measure of kidney disease. Creatinine is produced from the muscles, and it is excreted by the kidney. Whenever kidney dysfunction happens, this creatinine will start accumulating in the body. So it is an indirect marker, it's a surrogate marker that kidney is not functioning. Normally, people will have creatinine of less than 1, and more than 1 creatinine indicates they are having kidney dysfunction. And ultrasound abdomen, it is a very non-invasive investigation, simple investigation. It gives a lot of information about the kidney, and it shows whether the kidney size is normal, whether the kidney is not obstructed, there is no stone. All these informations we can get it done. We will come to know by doing ultrasound abdomen. But when usually we ask for ultrasound abdomen when there is a renal dysfunction, not otherwise. Our patient is symptomatic, having pain or frothy urine or those things. And whenever there is a urine is having frothiness, it is also an indicator that patient having protein leak. So they should get tested for urine analysis for protein leak. Once the proteinuria is there, next step what we will do is we used to quantify the protein leak. That is done with the protein creatinine ratio. That gives an idea about how much protein they are leaking. It indirectly says how much kidney would have got damaged, whether it's an advanced stage or this one. So, when more the proteinuria, there could be the other causes also. For that, maybe not only diabetes. There are many conditions where protein leak can happen. So, whether this protein leak is a sudden onset, that could be due to other causes also. Usually in diabetic nephropathy, it's a gradual process. But if it is suddenly there is a lot of protein leak is happening, that could be a condition where that is different from diabetic nephropathy. That also we have to diagnose. And whenever protein leak is there, eyes also will get affected. Whenever the kidney affects kidney is affected by diabetes, the eyes also will get affected by the diabetes. It goes hand in hand. So it gives a definite indirect clue that once the magnitude of the high involvement gives a reflection that kidney is also got affected. And kidney biopsy is the gold standard. We come to know why the kidney got affected, whether it is because of the diabetes or something else. That is a clear-cut diagnosis we'll get by doing the biopsy. But we reserve the biopsy for only those who are when we suspect non-diabetic kidney disease. When the patient is having proteinuria for a longer period and they are having diabetic retinopathy and kidney function, as I told earlier, is a slow progression, then we can come to a conclusion clinically that the patient is having diabetic kidney disease and we can treat that. Only when we have a doubt, there could be a possible reversible cause which can lead to kidney disease other than diabetic nephropathy, we'll do them for, and we'll subject the patient for biopsy. These are the changes we used to see in diabetic patients in the histology. That is the microscopy. After biopsy, these are the changes we used to see. And there is a big, important difference I want to tell you about the creatinine and glomerular filtration rate. Nowadays, many labs started giving glomerular filtration rate. What is it actually? Glomerular filtration is the exact reflection of the kidney function. Creatinine is a surrogate marker, as I told you, and it can vary. For 1.3 creatinine, for 72 kg person, if depending on his age and sex, the GFR may be different. For example, if you see 72 kg person with 30 years of male, the GFR for say, 1.3 creatinine is 84. For 50 years male, the GFR is 69. For 50 years male, it is only 58. So the same 1.3 creatine will give a different GFRs for different age group, sex as well as weight. So just without not that one creatine cutoff is only arbitrary. So we have to look into the GFR calculation exactly to find out what the exact kidney function is. This will be taken care of by your physician. And like now we'll move on to management. Lifestyle modification is very, very important in preventing the kidney disease in diabetic patients. So healthy diet, regular exercise, doing yoga, meditation, all those things will help you in preventing kidney disease happening in the later age. Optimum glycemic control is 7.5% HbA1c recommendation. Usually in younger age group, we target 7 and below. But in older people, its recommendation is 7.5% is fine. Because low sugars cause more trouble in elderly people than slightly we'll give some liberty to them to have a HbA1c of 7.5%. That is the recommendation. And diet, make sure you take good fiber diet. All 3 meals should have vegetables and fruits. And salt restriction is very, very important. Controlling the blood pressure, that is very, very important. When you, as I told earlier, that hypertension is an indicator for the patient developing kidney disease. It's a vicious. Kidney disease will lead to hypertension. Hypertension will worsen the kidney disease. So hypertension control will protect the kidney. So by salt restriction and adding medications, we have to keep the blood pressure under strict control. The recommended blood pressure should be around 135 to 85, 135 by 85. And we also insist on all our diabetic nephropathy patients and also those who are detected with diabetes and not yet developed kidney disease. We tell them every year they should get their eyes checked, nerves checked, and heart checked. AC inhibitors and ARBs, those who are diabetic patients having hypertension or will be familiar with telmisartan, losartan, olmesartan, such medications. These are all kidney preventive medications. These not only controls the blood pressure, it also prevents the kidney disease progression. These group of drugs are very, very important drugs in the management of kidney disease. But you should be aware, these medications should not be used when the patient develops hypotension, severe loose stools, fever, when they are hemodynamically unstable, better not to take this drug. This is a sick day rule. For 2 to 3 days, better to maybe up to 5 days, better not to take these drugs. Get your physician's advice, then restart this drug. Whenever you are taking this drug during the time of the hypotension, dehydrated status, it may worsen the kidney disease. It is a contrary. Though instead of protecting the kidney, it will worsen the kidney, patient will go for acute kidney disease. So whenever this is sick day rule, you should always remember. Don't take these medications when there is a crisis, intercurrent illness. but it has to be restarted at the earliest with the advice of your treating physician. Control of hypertension and diabetes prevents kidney disease, as I told in elaborately. And lipid control, cholesterol control is also very, very important. Controlling your, keeping the check, your cholesterol will prevent progression of the kidney disease in diabetic nephropathy patients. And cardiac care. Most of the time, if you see diabetic nephropathy patients, before landing into dialysis stage, they will succumb to cardiac illness. They will develop the incidence of acute coronary events, that is heart attacks, are more common in diabetic nephropathy patients than in general population. So that is why we recommend, please check your cardiac status every year, even without you don't have any symptoms. And we will be monitoring the progression of the disease with every 3 months checking their creatinine. And we vaccinate our patients for hepatitis B, pneumococcal, and also COVID. Already, most of you would have taken COVID. And hepatitis B and pneumococcal, once you get diagnosed of having kidney disease, better to take these two vaccinations. Even for general population above 60, we recommend taking pneumococcal vaccine. Once you cross 60, better take pneumococcal vaccine. That is very important because it's one of the most common cause of pneumonia in elderly age group. So it's a preventable disease. The vaccine is available. It is 2 doses with 2 months apart, and it should be taken. All senior citizens better take this pneumococcal vaccine. Hepatitis vaccine, usually nowadays it's given for all the children, but senior citizens who have not received it, only the high risk group, those who are detected to have diabetic nephropathy, should take hepatitis B vaccine. And protein and potassium restriction, depending on the stage of the kidney disease. And it's mainly for non-vegetarian. Vegetarian protein should not be an issue. What we consume in our South Indian diet, protein in vegetarian diet is only minimal, so it should not be a problem. Only those who consume high non-vegetarian diet, high protein supplements, they should be careful when they have diabetic nephropathy and kidney disease. There should be a restriction in protein intake of that sort. And whenever the GFR falls below 30 ml, they should restrict potassium intake also. The hyperkalemia risk is very high, and we may have to stop the drug which I told earlier, which is kidney preventive, that telmisartan, olmesartan, such groups, ARB drugs. This is also an indication when the potassium goes up, we have to stop, contraindication. So we have to stop the drug. And once GFR comes below 30, we usually prepare them for AV fistula. Next slides, I will explain about it. And usually they will require renal replacement therapy. That is diabetes. That is advanced diabetic nephropathy, which stay class 4, and they reach class 5 CKD, chronic kidney disease, when the GFR less than 15 ml per minute. Usually, by the GFR when falls below 10 ml, they will land up in dialysis. This is the AV fistula. Just for your knowledge, I'm telling about the dialysis and AV fistula. Just I throw light on it so that be aware of these things, and we can assure the people who are having a progressive kidney disease, there are treatment to keep them healthy even with the advanced stage of diabetic nephropathy. So they should not get panicked about the dialysis, but we will be doing dialysis only when it is necessary, not in the early stage. Only they reach the advanced stage, and it is only mandatory for the further survival of the patients. Patient will be started on dialysis. There are certain parameters. We don't base on, it's not based only on creatinine. Certain other parameters are there. Based on that, we'll start them on dialysis. And we'll prepare them when the eGFR falls below 30 ml. We'll prepare them for dialysis, and that's one of the way we prepare them is getting this fistula done. Fistula is nothing but connecting two blood vessels. We have two types of blood vessels. One is artery, and the other is vein. Artery is the one which comes from the heart to the peripheral vessel, peripheral tissue, and vein is the one which takes blood from peripheral tissue to the heart. So in between, we'll connect these two vessels, so that the veins will become, which are superficial to the skin, close to the skin, will become dilated, and the blood will flow fast in the blood vessels. This can be utilized for the doing dialysis. We'll put a needle and we'll remove the blood through that needle through tubing, and you can see this. This is the artificial kidney, this filter. So the blood comes, this machine helps for this blood to flow through this kidney, an artificial kidney. So the blood flow through this, this fibers which passing the blood will be surrounded with dialysate fluid. Through diffusion process, all the waste products will get into the dialysate fluid, and that dialysate fluid will be removed separately, and the purified blood will be given back to the patient. This session, every session contains 4 hours, and depending on the patient's condition, either weekly 2 times or 3 times they should undergo dialysis. And the another form of dialysis is home dialysis. It is done with these catheters. These catheters will be fixed into the abdomen, and this is the peritoneal fluid. This bag contains the peritoneal ultra purified fluid, and we have a cavity in the abdomen where these fluids will be filled from the bag, will be filled by gravity into that. I already told you that this tube is fixed in the abdomen permanently, and when we connect it as per the according this fluid will get into the abdomen, and we'll leave it for 4 hours, and we'll close it, and patient can move around. And then we'll connect the bag again and we'll drain it by gravity. The waste product filled water, that peritoneal fluid will come out. So by this way, we can do peritoneal dialysis at home. So patient need not come to hospital daily basis or weekly basis. They can once in 3 months if they come, that is enough. But we at home, they should keep doing this on their own. We'll train the patient himself or the attendant who can do this. One more available which is better than dialysis is transplantation, which gives the best quality of life and longevity of life. And the kidney, native kidney is retained in the same place. The donor kidney is placed in the abdomen, lower abdomen. In this area, we'll place it and we'll connect it with the blood vessels closer to that place, and also the filter will be connected to the bladder. And once the kidney start functioning well, no need to continue dialysis, but patient should be on immunosuppressive medications lifelong. If you see, prevention is cost effective. Dialysis, transplant are very costly, especially down on developing countries like this. The economic burden is so high. And we should, instead of focusing on treatment, funding the treatment part, we should spend funding more on the preventive part. So really training our children and educating our children on healthy lifestyle.
ಏನಾಯ್ತು?
Yeah. So we should focus on healthy lifestyle. Smoking should be stopped at any cost because it is an independent risk factor for the kidney disease. Obesity should be avoided right from the childhood. Give children healthy diet, avoid junk foods, and regular exercise, checking the sugar at regular interval, and blood pressure, keeping blood pressure under control, avoiding painkillers and even gastritis medications or any unnecessary medications. Avoid taking medication from the medical shop, over-the-counter medication. All those things will be very
Doctor, I have some pain in the soles of my feet.
Okay.
Sometimes it's not
Okay.
always, but sometimes.
okay.
Is it at the soles of my feet, of my right feet only, and on the
Okay.
soles?
Okay, sir.
Is it a sign of diabetic neuropathy or anything like that?
Yeah, possible, sir. Possible. How long you are having diabetes?
Diabetes, recently about 1 or 2 years. That's all.
Okay. Two things has to be looked into. One is neuropathy, another one is blood circulation also we have to look into. Once diabetes is there, there could be vascular compromise can also happen. So both the things to be checked. Whether the blood flow to the feet is good, that also we have to check it.
Okay. So is there a test for that, doctor?
Yeah, there is a test. So first clinical examination. Anything before doing any blood test or neurological test, first clinical examination that gives a lot of information. Then we have to specifically ask for the investigation if required.
Thank you, doctor. Thank you, doctor. Thank you, doctor.
Yes.
Doctor, this is Chandar. I want to know whether dentures cause anything related to increase in diabetes, then affecting kidney.
Nothing, sir. You can have dentures. Nothing. There is no relation.
Okay, there is no.
Only thing, it should be health. There should not be any infection and all those things that you have to take care. The infection part is the one thing you have to take care. Otherwise, dentures has got no relation.
One of my relative, hello,
Yes, sir. I am on. I am here.
one of my relative
Ah,
had a fever, viral fever.
okay.
Subsequently, he developed swelling in the feet. Is there any side effect like that due to viral fever?
Viral fevers can cause kidney disease. It can
No.
cause disease. It can cause cardiac disease also. So we have to check their parameters. So how is the liver function, kidney function, and heart function? These two things to be checked because they can have myocarditis, they can have acute kidney injury. So these are the possibilities. He hopefully is in a recovery phase, isn't it? He is recovering phase or he is still in hospital.
He is not in the hospital. He had
Okay.
a severe pain in the legs.
Sometimes what happens post infection, viral infection, arthralgia should also be there. Maybe it should be a local problem. Like that ankle joint would have got swollen because of the inflammation. Post viral arthralgia, we call it as. That
So
could be
nothing to
also be
worry.
a cause. Yeah, nothing to worry. We cannot tell unless we examine the patient and we'll do certain necessary investigation. So these are the possibilities I am telling you. So we have to figure out the exact reason. There are many causes for leg swelling. For simple reason is post-viral arthralgia, where there could be a inflammation in the legs. For example, chikungunya virus cause a lot of leg swelling, hands joint swelling. It will have pain for even for 2 to 3 months after the viral infection. So we cannot neglect it. We are better to be seen by the physician and examined.
Yeah. Doctor,
Yes, ma'am.
can you hear me? Yeah. I just wanted to ask you, you mentioned ACE inhibitors and ARBs have to be
Yeah.
withheld for some time. Suppose it is a
Yeah.
patient who's already on these medications.
Yes.
What's your advice during this period?
Yeah, that questions only I'm telling that advice. Actually, that is a sick day rule. The thing is, whenever there is a significant loose stools, for example, you are passing loose stools for 3 to 4 times significant quantity, and you are having severe dehydration, high grade fever. Those times better not to take that medication. Consult your doctor, check your blood pressure check and your hydration check. If things permit, then you can continue that. Otherwise, better to stop it. For example, many patients we are seeing, they are having pustules for developed, and the next day morning they will take telmisartan and they will be having low blood pressure. By the time the creatinine will also start raising. So don't take certain medications at that particular time. Consult your doctor, check your blood pressure check, then take. This is a 6-day rule that everyone should know. Whenever we are prescribing this drug itself, we are telling our patients nowadays.
Okay. Thank you.
Doctor, my name is Ashok Raikar.
Yes, sir.
I have my creatine level is 1.50.
Okay.
The doctor has advised me not to take more potassium. So potatoes have got more potassium. I have stopped eating potato. I am a vegetarian. So as per you, vegetarian
what is
food
your potassium, sir? What is your potassium, sir? What is your
potassium normal, within the range.
And are you taking any telmisartan, ulmisartan, like kind of ACAR?
Glim M2, telmisartan matter.
Whenever you are on telmisartan, the potassium consumption should be less only, sir, because that drug itself will have a tendency to raise the potassium. The thing is, that is a very good drug, but it has as a side effect, it increases the potassium. So unless you can keep your potassium under control, we cannot continue that drug. If you cannot continue that drug, the protection is lost. So that drug has to be continued in the expense of that potassium restriction. So that potassium restriction is important. But in the early stages of kidney disease, when you have a normal renal function and when they have hypertension without diabetes, we ask patients to take more vegetables and fruits. The more you take more fruits, potassium will help you to keep your blood pressure under control. It is a protective one. But you can have certain fruits like apple, pineapple, guava, papaya. These fruits without skin has got less potassium. You can have this. Actually, I recommend you to take vegetables and fruits in the early stage of kidney disease.
I'm always taking vegetarian food only.
Yeah,
So
you can take, sir, but only thing, keep a watch. Yeah. Yeah, please.
Okay.
Yeah, keep a watch on your potassium. If your potassium is well controlled, less than 4, you can have some liberty to take consume these things.
Okay, thank you, doctor.
Yeah.
Nephrology doctor, and met her also, and she suggested to do a PET scan.
Okay.
My father was not has some phobia in going into restricted areas, so he did not allow to go for the PET scan.
Okay.
So, but the doctor recommended it is good because if some treatable issues, we have to find out whether it is it is there. So I couldn't do the PET scan. Is it okay to go for a anesthesia and do a PET scan, or is it okay? My father is 87.
Okay, for what exact reason they ask for PET scan, I'm not sure. Usually, PET scan is done to identify the infective foci or malignant foci. So you have to discuss with the consulting doctor. You can talk to her again, and for exact what reason she has asked for, you find it out. Okay.
Okay.
If it is necessary, yes, we can go ahead with anesthetist help. We can get it done. It's not a difficulty. Nowadays, anesthesia, short-acting anesthetic medications are there. You can give it and get it. But the thing is important is indication, why it is asked for. So that you have to get clarified. And you should have a informed, you should give an informed consent about that.
From my father.
Yeah.
Oh, okay. Okay, doctor, thank you.
One question, doctor.
Yes,
I
sir.
smoke a lot. So, is there an acceptable level of smoking like that that I can bring down my smoking to, or
What is
any
your,
smoking is
what is
bad?
your age, sir? No?
I'm 58, doctor.
58. Please stop it, sir. There is no numbers. Smoking on the, it has to be stopped. It's all or none. You have to stop immediately. It's not like that reducing the smoking will beneficial. It is, should not, even smoking one cigarette is not good.
Madam Jambunath here, can I raise?
Yes, sir, please.
Doctor, good evening.
Yes, sir.
Thanks for an excellent session. It was very useful. Doctor. See, I just wanted to know, see, what are all the best tests that needs to be done for the senior citizen? Whenever, I mean, once in 3 months or 6 months like that, to ensure that all his parameters are okay.
Pardon, sir, what test you are asking? What test to be done?
What are all the physical, I mean,
as I told, urine analysis is very important. Serum creatinine.
okay.
Urine analysis and serum creatinine. These two things are very important, sir.
Okay, doctor.
And sugars, whether sugar is under control. Once in 3 months, HbA1c and FBS,
Okay.
PBBS.
Okay.
For diabetic patients, these are the tests, very important tests. These 4 tests.
Okay. Doctor, I'm not diabetic, but you just mentioned.
And yearly once, you are not diabetic. Okay. Yeah.
Yeah, my HbA1c level is 5.9.
Okay.
You just mentioned that it is better to have a higher level of HbA1c rather than a lower level.
Really, you are not diabetic means it's good actually. 5.9% is good. You are not diabetic. So actually 5.6 is the cutoff. 5.7 is the cutoff. 5.9 it's okay. You don't have family history of diabetes, isn't it?
Absolutely, absolutely.
Then what is your blood pressure, sir? What is your blood pressure?
130 by 70.
Are you on medication for that diabetic medication?
Yeah, I'm on medication. Yeah.
Anti-inflammatory you are taking. Amlodipine. It's good, sir. With Amlodipine, you are having a good blood pressure control. You continue that, but keep checking your parameters once in 6 months, sir. Once in 6 months, you visit your physician and get your health check. With basic investigations are enough, and also yearly once you check, see cardiologist. That is it.
Yeah. I normally go to a cardiologist also. He only, once in 7 8 months, I go to him.
And eyes
Okay,
also will check. Whenever diabetes,
eyes
not only for
are
diabetic, hypertension also to check eyes. I think you would have checked your eyes recently.
Yeah. Eyes are, I mean, at least once in a year I'm doing it.
Right. And do regular
Once in a
exercise and restrict your salt
yes,
intake.
sir, I do. Yeah.
You take a lot of fruits and vegetables. Make sure
Yes,
you are
sir.
taking vegetables and fruits all 3 meals. Avoid constipation. That is all you require.
Coffee. No, that's the one thing I said. What is the minimum amount of coffee I can take? Tell me that.
1 cup in the morning, 1 cup in the evening is fine, sir. Light coffee, not a strong one, light coffee. 1 cup of
That's all.
coffee.
I don't take anything. Yeah, I don't take anything more than that.
That is enough, sir. That you can continue, no problem.
Okay, doctor. Because somehow or other, I felt that if I don't take coffee, I will feel deprived.
You take it, sir. No problem. No
Okay,
restriction.
deprivation is also not good.
But no, make sure it is not strong one. And if you take twice a day, that is fine. No problem.
Okay, doctor. Thank you. God bless you, doctor.
Thank you, sir. Thank you, sir.
Doctor, that is metformin is any side effect on the kidney?
Pardon? I'm not getting it.
Metformin is any side effect on the kidney?
No. Metformin is a wonderful drug. It has got benefit for kidney. It has benefit for heart. It is a very good drug. But only thing, once the kidney function comes below a particular level, for example, EGFR less than 30, we cannot use that drug. Certain diabetic medications we cannot use because it is metabolized by the kidney. Kidney has to function to metabolize those drugs. So in that case, we are stopping that drug, not because that drug affects the kidney. Once the kidney function comes down significantly, these drugs will not get metabolized. These will start accumulating in the blood, and then the side effects of these drugs will go up. For that reason, we are stopping that drug, not because metformin affects the kidney. So actually, as long as the kidney function is in the good and in the early stage, it's better to continue metformin rather than stopping. But in advanced kidney disease, yes, we have to stop metformin.
The urine analysis has to be taken once in a year is enough, doctor?
Sir?
Urine analysis can be taken once in a year is okay? Urine analysis and creatine.
Urine analysis and creatine should be checked regularly, sir. For diabetic patients, at least once in 3 months, you have to get it checked.
Once in 3 months?
Urine analysis and creatine. All diabetes patients, better to check urine analysis and creatine once in 3 months when you check your HbA1c. So you can keep all these 3 things, HbA1c, urine analysis, creatine. These 3 things better to check every 3 months.
Okay.
My name is Shantaram.
Yeah.
In fact, 6 months back, I had visited, I was admitted in a new hospital.
Oh.
And I had met you before getting operated for the kidney stone.
Okay, sir.
Now almost 6 months has elapsed now. Recently, I'm getting some tingling sensation in my feet.
Okay.
And some sort of pain is there when I walk about. Very gingerly, I walk about.
Okay. Do you have it in your hands also, or only in the feet?
I have diabetes. My
hands also. Do you have similar thing in the hands also?
Not in the hands, doctor.
Only in the feet. Okay.
Only in the feet, and the sole of the feet actually.
Okay.
When I stand and walk in the morning after I get up, some sort of I have to walk gingerly.
Okay.
Then I wanted to ask you. Of course, I'll probably have to come and meet in the hospital to get these tests made.
Yeah.
So, what could be the reason for this sensation? I was wondering, doctor.
Yeah, it looks like neuropathy only, sir. Diabetic neuropathy. Anyhow, we have to check the vascularity of the legs. That is one thing. And there are things to reduce these symptoms. We can that you can come, we'll start that, but immediate results won't be there, but slowly, gradually it will improve.
Okay, okay.
If it is disturbing you, better come and consult us.
I will do that, doctor. I will do.
Thank you.
My HbA1c is around between 7 and 7.5 generally.
That is good, sir. For your age, I think that is fine, sir.
Yeah, I'm 74 now, and 74. Nothing.
Above 70, if you keep HbA1c around 7.5, it is fine, sir. No problem.
Okay, okay.
Thank you, sir.
Thank you, doctor.
Welcome. Yeah, please go ahead.
Sir, good evening. My name is Karuna Nidhi.
Yeah.
I am 64 years old.
Ah.
And actually, recently I'd been to hospital for my health checkup and other thing. All parameters are normal.
Okay.
And suddenly, a couple of days back, when I normally go for walking and do some normal exercises at home, actually. Suddenly, when I was squatting and standing up, a fraction of second, giddiness was coming.
Okay, you are not on any medicines.
No. I am a teetotaler. I don't have any problem as such.
Okay. When you are changing your head position, you are having more problems like this.
Normally, I stand vertical straight, and when I squat and get up, that time.
Okay.
Yeah.
Have you checked your blood pressure?
Yeah, everything, all parameters. That's what I said.
After these symptoms, after this symptom, did you check your blood pressure?
Yes.
Maybe it is a vertigo. Probably one possibility is it could be a vertigo, sir. Better you see a physician. Inner balancing system in the inner ear could get some issues at this age. The adaptation would have mildly changes. After examination, if physician suggests you to take Vertin, that is good. Actually, it will give a relief. But make sure no other issues. That will be those things can be found out by your physician after examination. Right.
Karunanidhi sir, you're on mute. Can you please unmute yourself?
Yeah,
So it looks like vertigo. Yeah, it looks like vertigo.
Yeah.
Vertigo. Yeah, you have to meet the physician.
Okay. And a normal physician or ENT specialist I have to go, sir?
First you see physician. Whenever you have any problem, first see physician. Then super specialist. Don't choose
Thank you, sir. Thank you so much.
Directly.
Nice talking to you. Bye.
Thank you, sir. Thank you.
Thank you, sir.
Thank you, sir.
Okay.
Thank you, doctor.
Thank you.
We have come to the end of today's informative session. I take this opportunity to thank Dr. Ramprasad for sharing his expertise with the members of Vaya Vikas. Dear members, thank you for joining us and for your active participation. Your questions and engagement have enriched the discussion and made the session more interactive and meaningful. We hope you found this webinar informative and that it provided you with a deeper understanding on diabetes and kidney health and its management. We look forward to seeing you at our future webinars and events. Until then, stay safe and take care. Thank you and have a great evening. Thank you, doctor.
Thank you. Thank you.